NICU environment through using different positioning techniques. Okay, so I'll start by describing who the NICU population is. The majority of the infants within the NICU are infants that are born prematurely, which means that they were born prior to 37 weeks gestation. Some of the other common reasons NICUs or infants are admitted to the NICU include fetal alcohol syndrome, exposure to toxic chemicals, respiratory distress, and sepsis or infection in the infant. Preterm infants are at an increased risk for delayed neurodevelopment, deficits in sensory processing, and development of neurobehavioral disorders, and that can include things like ASD or ADHD. So overall, the precautions, interventions, and education are necessary to provide the best practice in the NICU to promote healthy infant growth and development. I'll start by identifying the environmental factors in the NICU that impact the infant's development. So the NICU environment is often seen as a stressor to the development of infants who are in the NICU. The main areas of concern within the NICU environment include things like sound and light intensity, touch and handling, positioning, the development of the infant's microbiome, and then also the maternal stress. Modifying the environment of the NICU can promote growth and development as well as better meet the needs of the infant and the family. So this picture just kind of shows how intense the NICU environment can be for the infant. So sound in the NICU, the intensity levels are impacted by things that are within the NICU, including devices, monitors, the voices of the caregivers and providers within the NICU, and also the cries and sounds that the infants themselves are making. Research has found that the recommended noise intensity levels for the NICU should be below 45 decibels, and it has been found that the average NICU runs between 53.9 to 61 decibels for the sound intensity. Ways to modify the sound intensity in the NICU include implementing quiet periods, which can last 7 to 10 minutes, and those should be implemented up to 10 times a day. Or you could also use earmuffs or earplugs for infants who are extra sensitive to the sound in the NICU. So the light intensity in the NICU is another risk for development. It has been reported that high intensity lighting in the NICU can put infants at risk for poor circadian rhythm development, altered processing skills, and disorganized CNS functioning. The recommended illuminance level for hospitals is between 10 to 600 lux, and it has been found that NICUs run between 400 to 1,000, which is significantly higher than the recommended lighting intensity. The lighting intensity in the NICU can be modified by using time-based schedules with modern lighting technology, which produce better outcomes for infant stress and development. So touch and handling is another big thing in the NICU environment when handling infants. Potential overstimulation can cause physiological distress and not produce a soothing effect for the infant. It has been found that premature infants cannot regulate themselves when they're exposed to intense tactile stimuli. Skin-to-skin contact, which is pictured here, preferably with the mother, is the most beneficial form of touch that can be used because this is a crucial time span of development for infants in the NICU. Utilizing touch in the NICU through different positioning techniques can promote a flex position that is often missed in premature infants because they're born prematurely and don't get that time in utero in the flex position. And this can improve midline orientation and brain growth. And then last, in regards to the environment, is the concern for the development of the infant's microbiome. Infants housed in the NICU are at an increased risk for developing infection due to weakened or underdeveloped immune systems. The lack of breast milk and breastfeeding decreases the infant's development of their own microbiome, which puts them at an automatically increased risk for developing infection. Pseudomonas aeruginosa is a common bacterial infection that can outbreak within the NICU due to caregiving activities and providers and the contamination of different devices and monitors that are used on the infant. And this infection can cause an impaired lung infection, pneumonia, urinary tract infections, and also potential sepsis in preterm infants, which all of those things can impact their ability to develop once they leave the NICU.
Okay, I'm going to be talking about the effects of developmental positioning. So developmental positioning techniques can enhance both the physical and behavioral maturation of an infant. The main goals when utilizing positioning techniques for the newborn are to provide support and posture to their movements, to optimize the development of the biomechanical alignment, to provide controlled exposure to proprioceptive, tactile, and visual input, and to promote calmness and regulate the infant's behavioral state. So ultimately, proper positioning techniques can influence the infant's biomechanical alignment and movement, their self-regulation skills, as well as their physiological functioning. So when discussing the musculoskeletal structure, the first year of an infant's musculoskeletal structure can easily be manipulated by the positions that they're in, their movements, as well as their postures. At 24 weeks, preterm infants' muscle tissue, flexor tones, strolls, and spinal curvatures are not fully developed. And infants that remain in that flexed position for the full 40 weeks gestation exhibit stronger flexion than infants that are born prematurely. And this picture just demonstrates the normal spinal curvatures of a neonate versus an adult. Okay, when discussing neurological benefits, utilizing positioning techniques that decrease pain can stimulate an infant's neurological maturation. When proper positioning techniques are conducted, infants tend to cry less and have fewer behavioral indicators of pain, and those indicators could be grimacing or rapid blinking. And flex positions can supply preterm infants with a feeling of confinement, and this allows for improved self-organization skills.
Okay, so next we're going to talk about sleep positions. So the first one we're going to talk about is hammock positioning. This position is when a newborn in the NICU is set in a lateral position on a rectangular cloth, which is attached to the incubator's extremities. Hammock positioning can assist in preterm infants overcoming confinement, effects of the outside forces, and other sensory influences that affect the development of the immature brain. Hammock positioning has shown to reduce pain, aid in breathing frequency, improve sleep-wake cycles, and increase oxygen. The sleep-wake cycle starts during fetal life and continues through the postnatal period. Studies shown infants in the NICU who are placed in the hammock positioning engage in deeper sleep. Peaceful sleep is known to be associated with increased lung volume, stability and weight gain, and better organization of sleep and wake cycle state. Lack of sleep or rest is a significant stressor and can harm an infant's overall development. Infants have a greater neuromuscular maturity when in the hammock position than those who are in the prone position. So next, we're going to talk about prone positioning. This positioning is when an infant is lying on their stomach. Prone positioning is encouraged in the early hospital course to optimize respiratory mechanics. This type of position can improve lung and cardiorespiratory development, organize digestive function, and even ease the improvement of the infant's respiratory status. While a premature infant is in prone, they have a higher heart rate, decreased respiratory abnormality, and the infant wakes less frequently, promoting active sleep. When a premature infant has respiratory distress syndrome, studies have shown when laying in the prone position, it has reduced their tachypnea and tachycardia. Infants who need complementary oxygen due to respiratory issues, when placed in prone position, it decreases the amount of pressure on the abdominal organs and the diaphragm. If the infant is under any cardiorespiratory distress, they should only be placed in prone position if they're monitored at all times. And although there are many advantages of prone positioning, it also is a position that is much associated with being a risk factor for sudden infant death syndrome, also known as SIDS. Next is supine positioning. This positioning is when the infant is laid on their back facing up. Infants who are premature and have low birth weight have a higher risk of SIDS and other sleep-related death. SIDS is one of the top 5 leading causes of death in the post-neonatal period. Infants who do not have a respiratory issue should be placed in supine to reduce the risk of SIDS. Not only is supine position beneficial for safe sleeping, but studies have shown it also decreases positional torticollis. Infants in the NICU should be placed in supine position as soon as they are medically stable and before anticipated discharge. NICU nurses and medical staff must model supine positioning before discharge so families can be taught and shown the safe position for going home and decreasing the risk of SIDS. The American Academy of Pediatrics has a back-to-sleep, safe sleep environment recommendations to improve the sleep in infants. Some of those recommendations are no objects in the crib, one fitted sheet, no loose blankets, supine positioning, firm sleep surface, and room sharing but not bed sharing. And the last sleeping position is swaddling. When a baby is swaddled, it is important that they are in supine position and have their hands brought to midline under the chin, along with their hips and knees being flexed and be able to move freely. Swaddling has shown to positively impact neuromuscular development, decrease neurobehavior startles, improve sleep and self-regulation during handling, and decrease stress. Swaddling enhances motor performance and postural development. While an infant is in a swaddled position, their heart rate, respiratory rate, and oxygen saturations all remain stable and their development being amplified. And it's important to know when a baby's swaddled, if they start rolling, to just stop it immediately because it's not safe for them. Okay, next we're going to talk about feeding positions. And as Callie and Sydney stated, they're born in an extended position, which can affect the motor skills needed for feeding. Managing feeding problems in the NICU can reduce long-term challenges for the child as they grow. And specific positions used for the feeding help increase the food intake and potentially reduce the need of a gastric tube for feeding. Positioning used for feeding supports physiologic stability, which aids in increasing oral motor skills. And since the infant's oral motor skills and reflexes are not fully developed, choking is common in the NICU, and the correct position can reduce choking episodes throughout the oral feeding process. The first position is semi-elevated position, and this is when a newborn in the NICU is laid on their back while their head is elevated 45 to 60 degrees for feeding, and it's commonly used when an infant is transitioning to oral feeding stages or being bottle fed. The semi-elevated position provides support for head and neck alignment, and the feeder is in a greater position to observe responses and expressions of infant while feeding. And it can also enhance breathing through expansion of lungs. However, the gravity causes the tongue to lay in the back of the infant's mouth, which can potentially block the upper airways. And the gravity of the bottle also increases milk due to the vertical positioning of the bottle, which can increase the risk of choking, swallowing difficulties, or aspiration due to the underdeveloped oral motor skills. The next position is the sideline position, and this is found to be a greater position used in the NICU. And it's when an infant is in the sideline position, the bottle is at a horizontal angle, which decreases the outflow of milk and lowers the potential for aspiration and promotes better techniques for swallowing. The sideline position is important for the infant to gain the essential weight, as this position increases the food intake. And specifically, sideline position on the right side helps with the gastroesophageal reflux and digestion. The last position is the semi-elevated sideline position. This is when the infant lays in a sideline position with the head elevated 45 to 60 degrees. The angle of the bottle is held at a more horizontal angle, which also creates a slower outflow of the milk, which promotes better suck, swallow, and breathe coordination, which is needed for the feeding. And this position is recommended more than the FEP because the airway is more open as the tongue does not fall back, and it also is beneficial in creating a comparable position to breastfeeding.
So in conclusion, the data from our literature review supports that positioning techniques used in the NICU, as well as modification of the NICU environment, can best promote developmental outcomes for infants within the NICU. Further research is needed to fully understand the benefits of the specific positioning techniques discussed, as well as the recommended frequency for utilizing the positions. And it is important that caregiver and provider education is a part of the treatment and intervention in the NICU and should continue to be implemented to ensure the best outcomes for infants and families within the NICU.